A ChiroSecure research update. A study published in the Journal of Manipulative and Physiological Therapeutics determined if there was a basis for the treatment of temporomandibular disease, TMD, using the chiropractic protocol developed by Activator Methods International. 9 adult volunteers with articular TMD were recruited from the practice of the treating clinician. The main outcome measured change from baseline to follow-up of visual analog scale VAS for temporomandibular joint TMJ pain and maximum active mouth opening without pain. The treatment involved full spine and TMJ adjusting in accordance with the advanced protocol of Activator Methods International. Participants were typically seen 3 times per week for 2 weeks and, according to individual progress, thereafter for 6 more weeks. Out of the 8 participants completing the outcome assessments, the median VAS decrease was 45 millimeters and all experienced improvement. The median increase of mouth opening was 9 millimeters and all showed improvement. The results of this prospective case series indicated that the TMD symptoms of these participants improved following a course of treatment using the Activator Methods International Protocol. Consequently, further investigation of this type of chiropractic treatment for patients with the articular type of TMD is warranted.